Hello, my name is Keval Shah. I am one of the fourth year adult neurology resident at Detroit Medical Center, Wayne State University School of Medicine. And thank you for giving me this opportunity to present my QI project. My QI project is based on utilization of a CT-Head in patient presenting with breakthrough seizure. I would like to introduce my paper with some of facts. In the United States, there are estimated 3.4 million people suffering from epilepsy, and that is costing around $9.6 billion overall. On an average, these patients with epilepsy do present with breakthrough seizure in year about zero point 0.9 to 1.2 times per year. That would additionally cost $1.2 billion. There is insufficient data regarding performing an imaging study on patients presenting with breakthrough seizures. There is a study performed at Stanford University showing a data where 8.4% of overall CT had performed on patients with breakthrough seizure had acute finding. What I would like to present here is my QA project. Our methods were we obtained all the patients presented with breakthrough seizure in year between June 1, 2018 to December 31, 2018. We collected their history, we collected their diagnostic imaging, demographic data, EEG results, anti-seizure medication, and their history of epilepsy. Among all these patients, we selected randomly about 146 patients who had approximately 203 visits. I would like to show my data. So 146 patients visited approximately 203 times in ER during those 6 months. And out of those 203 visits, 103 visit had no CT scan performed, but 100 visit had CT-Head performed. And out of those 100, only 5 of the patient had acute finding. Acute findings are either stroke, hemorrhagic stroke, or new tumor or worsening of the tumor, which might have changed the management. Out of these 100 CT scan, 29 patients presented with first episode of seizure, and 26 of these patients had CT-Head performed, and only 2 of them had positive acute finding, while 117 patients had established epilepsy and had CT-Head performed about 74 times, and out of those 74, only 3 had acute findings. We also further characterized by different hospitals, including Sinai Grace, Detroit Racing Hospital, and Harper Hospital, based on where academic neurology service is present. So Sinai Grace, where we don't have academic neurology service, 107 ER visit where 49 CT-Head were performed, and only 3 out of 49 had positive finding. Compared to academic neurology service, Detroit Racing Hospital and Harper Hospital, where Detroit Racing Hospital had 79 ER visit with 42 had CT-Head done and only 2 showed acute finding, while at Harper Hospital 16 visits, only 9 CT-Head were performed but no acute finding. Based on our result, we figured that approximately at patients where academic neurology service, the positive findings were 6.7% compared to non-academic service where positive findings were approximately 5.1%. Based on our data, we come to a conclusion that utilization of a CT scan in patient coming with breakthrough seizure in established epilepsy, the CT scan results are very low yield. It does not help significantly to change patient's management. But with the larger cohort and multivariate regression analysis, we can come with a better data and we can provide any sort of guideline or recommendation before we order a CT scan on patient with breakthrough seizure. I also would like to mention my reference underneath my paper. Thank you for offering me this opportunity.